Hello everyone, this is Colleen Rice with Leadership Medina County. Welcome to our monthly Lunch and Learn. This month we have our vaping overview presented by Libby McGraw. She's a health educator with the Medina County Health Department, and we're so happy to have her with us today on Healthcare Month to talk to us about this important issue in Medina County. I'm turning it over to Libby now.
Thank you, Colleen, and thank you to everybody who is on our call this morning. I appreciate you guys taking time out of your day to listen a little bit about this information, and it's something that we at the Health Department think is so important. And I know through different community conversations that many of you also feel passionately about this issue as well. So hoping to bring some good information so that you can go out into the community and then share some of that with your colleagues, coworkers, families, and also answer any questions you might have. So we are going to go over some data, we'll go over some general information, and we'll show you some fun pictures of some of those up-to-date products and all kinds of different things. So again, thank you so much for taking some time out of your day, and we'll go ahead and get started. This first slide that I do want to show is some information about our Living Well Medina County Community Health Needs Assessment. So the information from here was pulled from 2017 data, and this is really, really good information because it shows really this big disparity that we're seeing among youth and adults. So you can see that about 14% of adults were current smokers that year, about 4% used electronic cigarettes, but when you jump down to the youth section of the slide, we see that about 14% of youth used those electronic cigarettes. So that right there tells us, wow, you know, we're seeing way more youth and adolescents using these products than adults, which I think is just very important for us to note. One of the other things I just want to point out is the link at the bottom here, which highlights our Living Well Medina County website, and that site has some really, really great information from our entire community health needs assessment, and that's information that we use, it's information that other agencies use, and we are just really, really happy we were able to bring some of that great data to all of you. So again, we'll, I'm sure, have different numbers in the next coming years, the next time that we do the health assessment, but for right now, these are the numbers that we're seeing, and we'll get into a little bit of marketing, what we're seeing with advertisements, but whether you like it or not, whether you think so or not, these numbers tell us, yeah, these youth and adolescents are using these products at a way higher rate than adults are. Okay, and now is my favorite slide, one of my favorite slides to show, I should say, but this is a great slide that shows all of the hard work that was done by tobacco prevention. So over the last several decades, we're seeing here that there was a big downwards trend in tobacco use. So the blue line is students and the green line is adults. So we love seeing these numbers because this shows, yeah, all that hard work we were doing, it was starting to pay off. We know that in the 50s, 60s, 70s, we started to see those numbers drop once lung cancer and other health illnesses were associated with smoking. And again, all throughout the 90s, 2000s, and the 90s, we see that it peaked in students a little bit. But really we saw those downward trends, which was very exciting. And in about 2006, 2007, around that time is when we really saw vaping products be introduced to the market. So again, as we see this number decreasing, we know that the tobacco industry was losing a lot of money. They weren't selling as many products, and so they really had a need to develop something that was going to get younger people addicted quicker so that they could start spending their dollars on those products as well. And again, we know that in about 2007, 2008 is when these products hit the market. There's evidence as early as the 1970s that really show, wow, there were electronic cigarette products that were being created back then, because that's when we really first started to see those numbers go down. So just something important to note. But again, I really like this slide because it shows all of that downward trend that we saw. And unfortunately, we might start to see that trend upwards a little bit now that we have electronic cigarettes that are out there. Here we have the National Youth Tobacco Survey, and these numbers are from 2011 and 2017. So on the high school student part of the slide, we see that in 2011, it was only at about 1.5% vaping rates were, and from 2011 to 2017, those numbers really jumped. And again, looking at the middle school section, you know, not even 1% in 2011 were using vapes among the middle school students, but we really saw that huge increase from 2011 to 2017 in both populations. Again, this was from 2017, but fortunately for all of you out there, we just recently got the 2019 National Youth Tobacco Survey data. So this was really exciting for us to see, although it was pretty overwhelming. We saw that increase in high school student use up to 27.5%, and then in middle school students we saw about 10.5% using vaping products. So I'm going to go back just so we can look again really quickly. In 2017 we saw 11% and 3%. And in that 2019 time frame, we have 10% and 27%. So really, really big differences. And you can kind of see at the bottom here, there are two blue lines and two blue indicators that show the percentage of high school and middle school students who use regular cigarettes. And we're still seeing that those numbers are staying pretty low. But if you look at the middle school line, which is the very bottom one, that number does start to go up a little bit. But that's the big concern, is that we might really start to see cigarette use increase again. There is an association with students who use electronic cigarette products, and they are more likely to start using traditional tobacco. So that is one of our main concerns as well. So here we have a nice image from the CDC, which really gives us a good overview of what many of these different products look like. We saw originally in the far right-hand picture, we have that original disposable e-cigarette. That was one of the first ones I even saw. And then those middle products, the big tank devices, electronic cigars, electronic pipes. And then these middle ones, off to the right middle, we have rechargeable e-cigarettes, and these are the things that you would see like the Juul, the pod devices, and those are the things that we're really seeing more of now. So that gives us a good overview of what some of those products look like. And then here we have all the different generations. So this kind of walks you through what was originally out there, how the technology has improved, what these products are now starting to look like. And again, you have those first generation, products that really, really looked a lot like traditional tobacco cigarettes. And then we just saw the products continue to improve in those second and third generations with the big tank devices. And now with these pod systems, many of these products don't even look like vaping products or tobacco products. They're things that you would probably see sitting on a desk, sitting in a pencil pouch or something like that, and you might not even necessarily know that it's a vaping device. So something important to think about just in terms of these discrete looking products and how they can be easily disguised. And we'll get into some of these products in real life right now. So I have to give credit to Wadsworth Schools because they posted a couple really, really great photos a couple years ago on their Facebook. And I absolutely love these because it gives us a real life look at what these products look like. This is what we're seeing. This is what we've got in our own backyard. So these were some of the vaping devices that they had collected from their students. You can see that many of these things, you might not even look twice at them, especially the one at the far right that looks a lot like a flash drive. That rainbow thing in the middle, that's a Swarin, so that's another brand of electronic cigarettes. You'd probably not even think twice about many of these. So that's really, really shocking to us because we know that these are being designed this way and manufactured this way for a purpose, and that purpose is to make sure that maybe adults don't always recognize that these products are being used by the youth population. And so this is my little game that I'll play with you guys, and if you just want to kind of follow along, I'll give you a couple moments. Try and see if you can spot any vaping devices here. And in the last slide, we had many of those products that are still in this photo. So just take a couple moments and see if you can find any of those products, and we will go through and see which ones that we know are vaping products. And while you're kind of looking for those, I do just want to mention, I'm talking a lot about youth vaping. We are obviously still very concerned about adult vaping, but when you look at those rates that we talked about earlier today, it's really the youth who are using these at the alarming rates, and we know a lot about what nicotine does to developing minds and things like that, and we'll get into some of that as well. But that's not to say that we aren't concerned about adults vaping. Surely we don't want anybody using the devices, but that's kind of why we focus on the youth, just because that's what's the most alarming in terms of the data. So if you've taken a couple minutes to look through here, we'll kind of go through these, just walk through one by one. So we have this one up in kind of the left-hand section of the pile. We've got the rainbow colored vaping device. Then right below it, we have that larger tank. Those are kind of the ones that we would probably suspect, especially that second one there. That right there under the red Sharpie is one of the pods. So that actually contains the liquid that would then be aerosolized when you're vaping. So this would be the type of thing that goes into something like a Juul or one of the other pod delivery systems. So again, that one before, I'm going back and forth now, but that one before, this isn't necessarily the vaping device, but it is still, you know, a part of the product. And then we have this one right here, right in the middle there. We have that right there as a vaping device. Down at the bottom, we know that that's a vaping device. And somebody had to point this one out. I didn't even notice that this one was there until a couple days ago. Somebody said, no, that, you know, one of the Juuls was right there, and I just didn't even see it blended in with all these different materials. Again, these are the ones that we're aware of. There could be items in here that are vaping devices that we're not even identifying or that we aren't even able to identify quite yet. So in terms of other newer products, my coworker and I, a couple weeks ago, we were very lucky to get to go down to Columbus for the Prevention Action Alliance Vaping Summit, and they had some great information about what are the current products, what are we seeing locally, what are we seeing statewide, and a couple people actually brought many of the different vaping devices that they're seeing on the market. And the one woman pointed out, you know, my credit card statement, it's crazy every single month. You know, people would probably be so confused as to what I do just because she's got all these crazy different products on her credit card bill. But for us who are working in tobacco and vaping prevention, we love seeing these products because then we can go forth and tell the community, hey, this is what we want you guys to look for. So this is the first one that they showed us. It is literally a pen. It writes like a pen. The part that I'm holding is the actual vaping device. And if you unscrew the top, that part that I'm holding then becomes the vaping device that you would put liquid into and then smoke it. And this one I really liked, especially because it's so timely with all the technology and Apple Watches, Fitbit watches, all of that. But this was in the far left-hand picture. This is a literal vaping device, and it looks so similar. In the middle picture here, we have it sitting next to somebody's Apple Watch, and you can kind of see the similarities. I wouldn't have even looked twice at those. So it's one of those things where if you're somebody who's a teacher, a parent, you might not even think to look at the watch and say, hey, is this actually an Apple Watch or a smartwatch? And in the far right-hand picture, you can see that that's the actual device that you pull. The face of the watch actually becomes detached from the wristband, and then you would then smoke that part of the device. So again, this one was just very, very startling. A key fob, so this is something, we had seen these pretty regularly too. We knew that these were out there. But again, if you're just looking at a desk or you're looking at something, you know, in a student's backpack, this might not be something you think twice about. And then the last one, which is one of my favorite ones, this is a sweatshirt that through the string of like the drawstring on the hoodie, it literally is a vaping device that's connected to a bigger device that's in the pocket. So the aerosol gets routed up through this mouthpiece, which somebody can be walking through the grocery store using it, somebody can be sitting in class using it, really many different ways that that can be disguised. So again, we just show these pictures, not to scare anybody, but just to show you, hey, there are devices and they're coming out with new technology all the time. So it's just really, really important that we're making sure that we're staying up to date with what these devices look like so that we can try and prevent use. Now moving on to one of the most common products that we see, that would be the Juul. So this is a brand of electronic cigarettes, and this is the most popular vaping device, especially among youth. As you can see up at the top here, 75% of the cigarette market is dictated by Juul. And in the picture here, you have the actual device, which is the big, long, black piece on the left there, and all those little colorful pieces, those are the Juul pods. So those are what contain the liquid, and one of those pods, so one of the colorful little pieces that's associated with it, that contains the same amount of nicotine as an entire pack of cigarettes. So I want everybody to think about that, because you think about somebody who smokes a pack of cigarettes a day, we consider that in the tobacco world as somebody who's really, really addicted. So if you have students who are smoking, or youth who are, even adults who are using 1 to 2 Juul pods a day, that's the same level of nicotine, and that's the same content of addictiveness in the nicotine as a whole pack of cigarettes or 2 whole packs of cigarettes. So one of the programs that we do is with the juvenile court, and we had a couple students just talk about their experience with Juul, and they said, I was up to 6 or 7 Juul pods a day. And so the withdrawal that they experienced then from having that nicotine removed from their bodies for so long, they had been used to it for such a long time to begin with. So that's a really, really high level of addictiveness that we're very concerned about. One of the things that I like to point out here too, and this is information that we got through the State of Ohio Health Department, but Juul, the company, recruited 89,000 social media influencers last year. So those are people on social media, Instagram, Twitter, Snapchat, and those are people who are promoting products, who are using products, posting about them, hashtagging with them, and those are things that we know that our youth are seeing that, especially with social media being as popular as it is. That's pretty telling of the audience that Juul is definitely trying to reach. One of the big concerns with Juul is also that it can be used with other substances such as THC or CBD oils. So again, just something that we like to make people aware of. One of the reasons that we believe now that Juul has become so addictive is because the type of nicotine that's used, it's a nicotine salt, so that actually delivers a smoother inhalation when a student or when any person is vaping, so it's not as painful. You don't get necessarily that burn that you might get with a regular cigarette. So that's less of a deterrent in that way. And then here we put the cost that's associated with these products. We know that a starter pack can range between $20 and $35, and then a pack of 4 pods is about $16. And compared to traditional tobacco, we know that on average a pack of cigarettes in Ohio, it can average around $5 or $6 a pack. So we see that the cost is pretty similar, but that's just something we wanted to point out as well. Now, the next thing we want to focus on are what is actually in these products. So we talked about what are the rates here in Ohio, in the nation, in Medina County, what do these products look like, and now I want to shift over to, well, what's actually in these and what makes them so bad for us. So all of these different products and ingredients, chemicals, have all been found in electronic cigarette aerosol. And that's the first thing I want to mention. I call it an aerosol, and all of us that work in this field call it an aerosol. There used to be a big misconception that vaping, that the smoke was of water vapor. We would hear that all the time. No, it's not so bad. It's just a water vapor. But we know now that, no, it's not a water vapor because those chemicals and ingredients are sticking in the air. So that technically does classify it as an aerosol. I would say probably about a year ago at this time, we didn't ever really talk about secondhand smoke related to vapes because we just didn't know. But now we have conclusive evidence that says, yes, we do know that secondhand smoke from vaping can occur. When you're in the same room as somebody who's vaping, in the same car, you're taking in those chemicals just like they are, which is something we saw with regular tobacco and smoking as well. In this slide, and this slide is actually a little bit old now. There's probably ingredients that are not on this list that are certainly used in vape liquid, but a lot of these have a lot of crossover with regular cigarette ingredients. So we know that things like acetone, formaldehyde, ingredients like those were also used in regular cigarette ingredients. So again, things that are carcinogens that we know about, things on this list, things that aren't on this list, those can still be harmful to the body. I'll get people who also say, yeah, but I don't use the nicotine liquid. Well, that's good if you're not using the nicotine, but many of these chemicals are still found in the non-nicotine liquid. We see flavors that have crazy different materials and ingredients, heavy metals, carcinogens, so all of those kind of fall under this category of the different types of contents that are in different vaping products. Now, in terms of health, the first thing I'm really going to focus on is nicotine-related health concerns, and then towards the end we'll start to focus on, well, what are some of those other health concerns? Nicotine, again, with the youth population, that seems to be the one that is really, really concerning just because that's what we know the most about right now. So we'll kind of cover all of those different facets with nicotine. But as we can see here, we know that nicotine releases that dopamine. It gives you that sense of pleasure, that feeling of pleasure. and it reinforces that repeat use. And users do develop that tolerance with, repeated exposure, repeated use, and everything like that. And when people are not using nicotine anymore, we do know that they experience those withdrawal symptoms. So like I had said, we had a student who mentioned that he used probably 6 or 7 Juul pods a day. He certainly was experiencing these he was certainly experiencing these side effects. And that's something that happens to adults, students, anybody who really withdraws from nicotine. And down at the bottom here, this is specifically youth nicotine addiction. We know that that exposure early on impacts that brain development. It primes the brain for addiction, for other illicit substances as well. What we see in the brain, and I'll just kind of go over this very briefly, but the frontal lobe and the temporal lobes are the parts of the brain that we know are very affected. And, we tell people all the time, I hear it all the time too when, you go into health classes or present on topics, but the mind isn't really fully matured until about the mid-20s. And so when you have students who are vaping as young as 13, 14 years old, that nicotine is certainly going to get in there and, make a bad impact on that. So we see in the frontal lobe some of those different things that are affected, the temporal lobe with what are those other facets that are affected. And introducing nicotine can really impact all of these. So impulse control, hearing, speech, understanding information, making judgment calls, reasoning, learning. So those are things that if you're a youth or adolescent, even young adults who are in the college age range, they're still needing to develop these skills as well. Okay, so here we have another image, and a lot of these images come from the Ohio Academy chapter of American Academy of Pediatrics, the Ohio chapter. So we really like all these images just because it gives us a good visual. I'm a very visual person, so I kind of like also seeing, hey, what are the ways that this can actually affect all the different parts of my body. With nicotine, we know that it can increase clotting, it can cause different pain in different muscle systems, it can cause gastrointestinal problems, joint pain. It can also impact your heart, so it can increase that heart rate, increase that blood pressure, and things like that. And then cognitively and neurologically, again, we know that it can increase lightheadedness, headaches, and when you remove nicotine from the body, so like we talked about with withdrawal symptoms, these are things that we know are still occurring as well. And then this is just another slide that I thought was really impactful, and I think it just highlights that, yeah, you might be taking in nicotine through the mouth, you might be breathing it in and inhaling it into your lungs, but what do your lungs do? I mean, your lungs work with your heart, and that carries oxygen and blood cells all throughout your body. So really, when you're introducing that nicotine into the system for anybody, that's going to impact and reach all of those different major organs as well. And then lastly, I think this might be the last nicotine. I think I have 2 more nicotine-related slides before we get into those other vaping health concerns. But this slide, I think, is really impactful because it just shows how addictive nicotine is. So here you have a slide, and these are for people ages 15 to 54, it looks like. And you have cannabis, alcohol, cocaine, heroin, and tobacco there has that highest percentage of likelihood of becoming addicted after using it. So again, we talk about all kinds of different substances and why, they're not good for us, and tobacco is certainly still lumped into there. And just looking at how addictive it is, it's still right up there with all of these major substances as well. And now, I apologize, this one I think, for whatever reason, the lettering was kind of off with this slide. We used it from, again, the Academy of Pediatrics from the Ohio chapter. But I thought this was really important because we'll get a lot of questions about smoking cessation. And I know that these are marketed certainly as smoking cessation products, but people will say, oh, but I use it to quit smoking and it really helped me. And I think case by case, if you know somebody who has quit smoking by vaping and now they're not doing either, that's great. But this slide unfortunately shows kind of the opposite. So in this top tier of the graph, we see that about 18% of people had successfully quit at 1 year if they used vaping to quit, but after a year, about 80% of those people were still vaping. So again, they're not smoking regular cigarettes, but they are still using electronic cigarettes. And then in the bottom tier of this graph, we see how effective other nicotine replacement therapy is, and that shows us that about almost 10% it looks like successfully quit at 1 year, but only 9% of those were still using that nicotine replacement treatment. So I will preface and say that I am a certified tobacco treatment specialist, so I do have experience helping people quit smoking, and I do have the training for that. And at this time, we are not allowed to to tell people to vape to help them quit smoking. We recommend nicotine replacement therapy, talking to their physician about taking a medication. Of course, working with a counselor, somebody like me, but really we can't say right now if vaping helps because, again, through this slide you guys can see that we're kind of looking at the opposite there. In terms of other health concerns related to vaping, we do have quite a few of them. So we know that respiratory illness, and I'm going to get into this one in the next slide here, so I'm just going to kind of put a pin in that one. We know that altered brain development, especially among youth and young adults, increased risk of tobacco use, and that's for anybody. Illicit drug use, lung residue, again, this is classified as an aerosol, so it can definitely leave traces of materials. Ear, eye, and throat irritation. Physical injury is one that we're seeing more with those tank devices that have batteries, and these are ones that can actually explode and cause, you know, second-degree burns. There have been reports and records of exploding devices causing people to, you know, get in car accidents, unfortunately, and things like that. So probably not something that you hear about as frequently, but definitely something that still occurs. Wet lung and popcorn lung, those are two lung-associated illnesses. Popcorn lung is associated with a flavor that is used in some of the different ingredients and different flavors that we're seeing in vapes. And then I always put limited research on here as well because these are the things we know at this time. It took us about 50 years to really realize that smoking regular cigarettes caused lung cancer. So for us to really get a conclusive idea of, hey, this is what vaping can do to the body, it might take us a little bit more time. And we certainly are learning new things, you know, almost daily about the products. Now, in terms of the respiratory illness that I wanted to cover, I will say that I am not a clinician, so I'm not going to go too far into this subject, but we do know that the CDC is currently tracking an outbreak of lung illness, and they call it EVALI, E-V-A-L-I, and that stands for electronic cigarettes and vaping-associated lung injury. There have been about 2,400 cases across the nation, and I believe it's in all 50 states. But people have presented with these extreme lung, chest pain, awful, awful side effects with their respiratory system. And for a long time, they were trying to figure out what the association was. But many of these people, all of them who they have actually interviewed, have had some sort of experience with vaping. And a lot of these are associated with black market THC liquid. But again, it's hard to say conclusively what it actually is that's causing this. So we had 3 cases here in Medina. So in our own backyard in the county, we did have 3 people present with these symptoms, and we have had about 52 deaths across the nation. So something real-time that's happening that we're seeing. People are going to the hospital. We have had people who are dying from this. Something really, really to think about. Now, kind of shifting gears over to one of the concerns related to advertising. I love to show this slide. Obviously, you know, when I'm in person, people always laugh at some of the different flavors, and it's kind of funny to see, oh, Dr. Pepper flavor, bubblegum flavor, that's, you know, that's funny, and it is. But really, when I look at this slide, and once we talk about it with people, we realize that, wow, these are flavors that are much more appealing to people who are younger. Chocolate chip cookie, the popsicle one right up there in the middle. I mean, those are things that for youth, they are definitely more appealing to them. I do have a study that just came out that I wanted to, I found the information about it, and I wanted to read a couple of the statistics from it. But again, we know that thousands of these flavors are out there, and these are all just so appealing to youth. But there was the Truth Initiative, which is a really big tobacco prevention group. They did a big study in Cleveland and in Dayton. Overall, they said, though, and this is specific just to the nation, this isn't specific to any state or anything like that, but they said that more than 80% of youth who have used tobacco report that they began with a flavored product, and 97% of youth who vape use flavors. So again, that last part, 97% of our youth who are vaping are using the flavors. We know that that's appealing to them. We know that there are lots of reasons why they're vaping, but this is certainly one of those reasons. Like I said, they did the study here, I think, in Cleveland and Dayton, but tobacco, they found that in the Dayton and Cleveland areas, tobacco products were cheaper in neighborhoods with higher percentages of young people, and they found that nearly every store located near a school displayed ads for flavored tobacco products outside. So again, we know that these companies are really seeing the flavors and how appealing it is to youth, and they are finding ways to make it even more appealing to them. Now, with some of these different strategies that they're using, we're seeing a lot of overlap with how tobacco was originally marketed. Celebrity spokespeople sponsoring different youth-led activities, sports, music festivals, of course the different flavors. Blue e-cigarettes specifically has a cartoon that they've used. And we all know, and I'm sure many of us remember, the Joe Camel cartoons, and that was something that they eventually had to remove from the market or they had to remove the Joe Camel cartoon because it was so appealing to youth. And we're just seeing a lot of those similarities with the way that electronic cigarettes and vapes are being advertised as well. And we'll get questions, and that's why I wanted to just touch on this briefly. In terms of regulations, the regulations for vaping products are very loose. And I love it when I get a student, especially if I'm in a school or in the community, and I get a student that says, if these things are so bad for us, why are we still making them? Why is it still okay? And that's always a tough question to answer because we all know that there are all kinds of different things that are regulated and everywhere that are not necessarily good for us. We've got alcohol that's regulated, tobacco is still regulated, cigarettes are you can legally buy them and things like that. So that's where it gets really, really tricky. But we know that the regulations are loose. It began in about 2016, but anything that was developed before 2007, is going to be exempt from this pre-market authorization. So by 2020 of next year, or by August of 2020, all of these different products that are out there that manufacture vaping products are going to have to get some sort of pre-market authorization. But again, anything that was developed before then, they're kind of off the hook. So that makes it really hard as well, because there are still those products that are out there that were developed very early on. And again, during this time that they're waiting to get that authorization, these products can all stay on the market. So you might get something that comes out tomorrow, and they can stay on the market until they get approved. Now we are seeing that there are more local efforts to ban flavors, which I think is really exciting. We see different cities and different states kind of taking their own stance against the issue. Here in Ohio, we had Tobacco 21 passed back in October. It took effect, so now you have to be 21 to purchase any sort of tobacco or vaping products here in the state, and that was really exciting. Now, I want to kind of wrap up by just mentioning some great resources for youth, for adults, for anybody. So the first one is this My Life, My Quit, and this is a text and quit line specifically for students who are trying to quit vaping. I love this because I don't even really like to talk on the phone. Kids who are younger and youth certainly aren't wanting to talk on the phone. So I think this is a really, really great way for them to, this was a great way for them to engage their own tendencies like texting rather than talking on the phone and stuff like that. So I think that's really appealing for them. We have smokefree.gov, and that has a lot of great information about educational materials. You can set up a quit plan if you or somebody you know is trying to quit smoking. I believe that there's some sort of texting support through this program as well. The one that I especially want to plug is our Ohio Tobacco Quit Line, and this is a free resource. You can call this. Right there it says available 24 hours a day, 7 days a week, and that's a way to get some really, really great support. They can even prescribe nicotine replacement therapy and things like that. And then the CDC is where we get a lot of our great information. Right now, if you do have additional questions about the lung outbreak of EVALI that we were kind of talking about, I think they update information, I want to say weekly, and if not weekly, every couple of weeks. So they really do a good job of keeping up-to-date information there. So that is everything that I have, and I do want to show you our references really quickly so you know where we get our information. We have a lot of great partners that we work with, but we will, I believe, take this time to open up for questions.
Thank you so much, Libby. We are going to open up for questions right now, so we're going to change from lecture mode to have a question. You can text the question or you can get into the queue to ask a question. So we're watching the queue right now to see if anything comes in. But Libby, what got you interested in learning more about vaping?
We really started, I would say, so I've been at the health department as a health educator for about 4 years, and I would say pretty much as soon as I started, we were receiving inquiries about vaping. So that was back in 2016. We started to get a couple questions here and there, and people would say, we're starting to hear more about this vaping, but I would say really in the last 2 years, we've started to get a lot more inquiries from schools, community partners who are looking at this data, and I know everybody reads the headlines and social media and the papers and things like that too. So really it was just the need for it in our community, which is why now we're taking such a stance against it. We are trying to really increase our tobacco and vaping prevention efforts in the community. So really anytime anybody has questions or is interested in getting involved, they can certainly contact us at the health department.
That's great. So you're available for speaking engagements for other groups or locations in Medina County?
Yes, we will. Myself or my counterpart, we are available to do presentations. We're also talking about starting up a vaping task force. So if people are interested in that, you can visit our website. And I believe we have a nicotine page which has my contact information on it as well, and we'll have it at the end of the slides here too. But if you're interested in that, you can certainly contact us that way.
All right, I'm not seeing any questions. If you're having trouble sending us questions, you can also text me at 330-391-8238. That's 330-391-8238. 8238. You can send me a text and we will answer that question while we're on the call today. Another question. So you're a tobacco cessation counselor?
Yes, so
okay.
I am a certified tobacco treatment specialist. I know it's a lot of initials.
It is. That's a mouthful.
Yeah, so I had that about, actually it's almost been 4 years now, since I've gotten that training as well. But it's a training where you go and you take a week-long course, you have to take a big test, and then you have to put in so many clinical hours actually working with people. And we currently are working with pregnant women to help them quit smoking. It's a pretty small program that we have, and it's something that we started a while ago. Unfortunately, just with staff time and availability, it's something that we can't really expand at this point, but it's something that we do have. But yeah, so that's been my experience with tobacco cessation.
That's great. Well, I am not seeing any questions come in, Libby, so it looks like you answered everybody's questions really well today during your presentation, and we can't thank you enough for spending the day with us. If you want more information about the Medina County Health Department, you can visit their website at www.medinahealth.org. You can also see the information of how to get a hold of Libby, so if you do have a question that you want to ask that you didn't have a chance to during this session, or if you're listening to it recorded and want to get in touch with her, please use that information and reach out to her and she'll connect you or try to answer your question to the best of her ability. The health department has a lot of great programs. This is just one of them, and we're just so appreciative to learn a little bit more about our local county health department. And our Lunch and Learns are monthly Lunch and Learns that we're doing. If you have an idea for something that you would like to learn about or a speaker that you'd like to have in, please contact our office. You can email us at info@leadershipmedinacounty.org. And again, you can find out about all of our programs and upcoming events at www.leadershipmedinacounty.org. I want to thank everybody for participating in today's Lunch and Learn about vaping, and thank you again, Libby, for sharing your time with us.
Thank you, everybody. Thank you, Colleen.
Have a great day. Goodbye.